Tom. I'd like to talk to you about TMJ. First of all, let's start off with, what is TMJ? TMJ is a temporomandibular joint. That's the joint right here in your body. There are two of them. There's one on each side, and when you open and close your jaw, that's the joint that moves. It's composed of a head of bone and a disc that sits over it. And the disc that sits over top of it looks kind of like a donut. Some people have clicking or popping in that joint, and what that is when they're opening, the disc is displaced off the front side. And as they open, it pops right back where it should be, and then as they close, it pops back off. So usually we have two pops in that. A normal disc where it sits right on top of the head or condyle won't pop at all. So that's the anatomy of the joint itself. Most people with TMJ problems really don't ever have a problem with that joint itself. It's more the muscles that make it work. There's a major muscle group here called the masseter muscle. There's some internal muscles in your jaw that are the pterygoids. They're muscles also that make the lower jaw go up and down and close. Then there's the muscle right here. It's a positioning muscle that positions your jaw. Those muscles will get into spasm and they'll be very hot. That's typically what I see with TMJ patients. Now, what's a typical TMJ patient? Well, typically women, middle-aged. I find that most patients are post-ortho. In other words, they've had orthodontics done when they were a teenager. Usually have had 4 bicusses extracted and had their middle face pulled back. If you think about Mother Nature grew your body the way it did for a reason, and every piece was put where it should be for a reason. So if your teeth are all sticking out and crooked, and because your tongue and your lips and your muscles wanted them there, that's usually the reason. Orthodontist comes in, pulls everything back, retracts it, gives you less tongue space, affects your head posture. Your head posture affects all kinds of things. One of the things I do with our patients is I hand them a 10-pound medicine ball and tell them, this is what your head weighs. And they'll kind of do that with it. It's amazing. So if your head's positioned forward, in a forward position, and you're having to support that to keep your airway open, all kinds of different reasons, bad bite, what's that going to strain? That's going to strain your neck and shoulder muscles. So what we'll typically see with TMJ patients are hot muscles in their neck, shoulders, forward head posture, headaches, sometimes tingling in their fingers, ringing the ears, pain behind the eyes. These are all symptoms that go along with TMJ. So how do we diagnose it? I do a workup on patients involving a machine made to test muscle activity, jaw tracking and jaw position, and joint sounds. Those are the 3 components to it. So we put on something that looks like a pair of headphones, and we'll have the patient open and close, and we'll graphically see on our computer screen what this looks like as far as a graphic of the sound, when it occurs, and how loud is it. The next phase, we'll put a little magnet right here and a little sensor array, and I'll track all the jaw movements, and we'll see how the jaw moves in 3 dimensions. The last component, we will put electrical sensors on that receive electrical activity. So if I'm just sitting right here right now doing nothing, my muscles should be having no activity. In a TMJ patient, we'll see there's electrical activity going across these muscle groups. So we'll look at those being flared up and to what degree and which muscles. The next step is we'll use a TENS unit, and a TENS unit sends a minute electrical pulse every 3/4 of a second into these muscle groups, getting them nice and relaxed. It kind of releases everything. Once we get everything released, we go back on the computer, verify that all these muscles settle down from our prior readings, and then we capture a bite for the ideal position of the patient. I was taught in dental school, and most dentists were, to manipulate the jaw. In other words, you come here and you grab it and you put some material in between and you wrestle the jaw into the ideal position, which is up and back. Well, quite frankly, that's just wrong. The best thing to do is to relax the muscles, let the jaw come up on its own, and capture the bite that way. We capture the bite so we can make the patient an orthotic or a splint, and that splint is made at an ideal position. It allows the lower jaw, just like an airplane, to pitch, yaw, and roll to exactly where it wants to go. Once we have that orthotic in place, we'll have the patient wear it for a day. We'll adjust it again in a week, maybe 2 weeks, a month, until the patient gets better. Often we'll work in other professionals, chiropractors, physical therapy, things like that. We may need that, might need some Botox, but generally I can get someone comfortable with just using the orthotic. In adjusting the bite, we do use one more piece of technology that's somewhat unique. I'm sure most of you've had your bite adjusted with the blue paper. The page, you bite down on it, tap, tap, tap. Dentist looks in and sees the little marks. Well, that tells you nothing about timing and force of those marks. When you bite down hard and squeeze, you may have 8 marks across the lower right side. But which one hit first? How do you know? We use a device called a T-scan that's a little wafer that you bite down on, and it graphically shows me which marks come in first and which marks come in hardest, and the balance left right of the bite. A bad bite is usually the root cause of TMJ problems in hot muscles and things like that. So 2 pretty neat pieces of technology we employ to help patients solve their TMJ problems. The K7 by Myotronics and the TechScan. If you have any questions or would like to come in and talk to me about this, I'm Dr. Tom Hedge.